What does it mean to be mentally healthy? My thought on this important question is to live without psychological obstacles that may be impacting your functionality, wellness, and ability to engage and enjoy your life. There are times in our lives that can be stressful, and we do our best to weather the storm. During situational times when we are struggling through navigating the loss of a loved one, transitioning to a new job, or going through a breakup, we may experience what is referred to as an adjustment disorder. Negative symptoms we are experiencing due to this kind of challenging circumstance may go away once the difficult time is resolved. Sometimes things don't resolve themselves so easily, and if we not address, we can develop into a more substantial struggle. Sometimes we have a history of unpleasant times in our lives and feelings associated with those times. We can feel worried or down, and we may experience different degrees of depression and anxiety. We do not always have awareness, address, or talk about these feelings. Not addressing depression and anxiety can have you feeling stuck and not living a life that is desirable to you. For this episode, I will be focusing on depression. Feeling down, upset, stuck, frustrated? You might be experiencing depression. Developing an awareness of what might be occurring is a great start to the change process. Many people experience these feelings but are unaware about what to do. This is where therapy and/or medication management could be helpful. Sometimes we need to develop skills to cope with life and its challenges. Sometimes we need to process experiences that have occurred, and other times we need to process and reflect on our lives in order to uncover the origins of our suffering. This journey to grapple with depression can be challenging. For that reason, many choose not to address their suffering. When we are depressed, it is often hard to get out of that rut. It takes courage to actively engage in your change process. In order to change, we need to acknowledge life is a journey filled with ups and downs. Each day is filled with a variety of experiences. Our attitudes towards these experiences affect our moods. At times, we may believe we are stuck and without any choice. Other times, we may feel as if we are not living the life we had hoped for, and the one that does not feel authentically ours. We might feel estranged or separate from ourselves, and these experiences can breed depression. Reasons you might be depressed. Do you feel down on most days? Restless? Fatigued? Losing interest in things you enjoyed doing? Difficulty concentrating? Experiencing inappropriate guilt? Doubt yourself and have trouble being yourself? Or have some self-worth or self-esteem issues? Issues from the past can affect us in the present, impacting difficult relationships and potentially causing depression. Coping skills may not have been modeled for us during our childhood and possibly absent from our daily living. To foster change, promote positive growth within ourselves, and treat depression, it is sometimes important to develop useful skills such as identifying our inner awareness, evaluating our thoughts, feelings, choices, and communicating effectively and regulating our emotions. Depression can stem from being dissatisfied with our lives and questioning life's meaning and purpose at times. Though these concerns are part of life, the ability to uncover what lies beneath and the process that we are truly struggling with is fundamental in moving forward. Depression can encompass an underdeveloped ability to assess an accurate perception of ourselves and an inability to face, identify, and explore our problems and our defenses. Depression can occur because of distorted thinking, which consciously or unconsciously clouds our perception thoughts, and feelings. This is often comprised of how the past may be affecting our present. We are born into a world that is chaotic, and we must learn to make sense of our world and our lives. What happens when we aren't loved as we needed to be, or exposed to trauma? Observe maladjustive behaviors for those that are modeling for us how to navigate this strange world. It seems that disturbance or anguish can surface. Depression serves as an alarm that something is not right, something must change, yet we are not always ready to heed its message. We develop patterns of behavior, defenses, and ways, good or bad, of coping with our circumstance. This way of being becomes automatic. Oftentimes when we don't even know we are sick. When we are physically sick and we don't go to the doctor for treatment and work towards wellness, we remain sick and often get worse. This holds true for our mental health as well. I surmise that if we do not address our suffering, it can become diagnosable and pathological. Sometimes the suffering is too much, and we may be best served by seeking treatment. Depression can be debilitating, especially when we are negatively talking about ourselves, our world, and our future. Depression is synonymous with negative self-talk. The work is in challenging our thoughts and our feelings to live and grow as we desire. If we are happy with who we are, our lives, and feel we are loved, appreciated, and connected, we will be happier, less anxious, and less depressed. Through addressing depression and seeking treatment, you can begin to live more fully. Therapy can help enable you to live the life you want to live. Thank you for joining me today. Stay well and healthy and in tune with Hive 80. Thank you.